Public notice. The general public is hereby informed that following the 3-day national lockdown and the continued threats posed by the coronavirus disease, His Excellency President Dr. Mada has directed the following new measures with effect from midnight Sunday, 11th April 2020 for a period of 14 days, subject to review. First, a partial lockdown restricting the movement of persons at inter-district levels, except for the transportation of goods and essential services. A pass system authorizing the transportation of goods and essential services will be announced before commencement of restriction. Secondly, a night curfew from 9 p.m. to 6 a.m. Third, a readjustment of official working hours for all public and private sector workers from 9 a.m. to 4 p.m. As the government continues to intensify efforts to curtail the spread of the coronavirus disease, the public is advised to, as far as possible, stay at home and observe basic hygiene practices. I am in Sierra Leone now. There are 8 confirmed COVID-19 cases till date, and there are 445 people in quarantine, and all the people in this country just finished a 3-day national lockdown. In order to curtail the spread of COVID-19, the government just announced a partial lockdown from 11th April 2020 for 14 days. Today, I will introduce some general knowledge about COVID-19 to you so that we can protect ourselves well. Question 1. What's the coronavirus? Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from common cold to more severe disease such as Middle East respiratory syndrome, MERS, which called MERS, and severe acute respiratory syndrome, which we called SARS. Question 2. What's coronavirus 19? COVID-19 is an infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. Question 3. Can COVID-19 be caught from a person who has no symptoms? The main way the disease spreads is through respiratory droplets expelled by someone who is coughing. The risk of catching COVID-19 from someone with no symptoms at all is very low. However, many people with COVID-19 experience only mild symptoms. This is particularly true at early stages of the disease. It is therefore possible to catch COVID-19 from someone who has, for example, just a mild cough and doesn't feel ill. WHO is assessing ongoing research on the period of transmission of COVID-19 and will continue to share updated findings. How to protect yourself. Stay aware of the latest information on the COVID-19 outbreak, available on the WHO website and through your national and local public health authority. COVID-19 is still affecting mostly people in China, with some outbreaks in other countries. Most people who become infected experience mild illness and recover, but it can serve for others. Take care of your health and protect others by doing the following. Regularly and thoroughly clean your hands with an alcohol-based hand rub, or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Maintain at least 1 meter 3 feet distance between yourself and anyone who is coughing or sneezing. Why? When someone coughs or sneezes, they release small liquid droplets from their nose or mouth, which may contain virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus, if the people coughing has the disease. Third, avoid touching eyes, nose, and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter into your body and can make you sick. How to put on, use, take off, and dispose of a mask. First, before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Secondly, ensure the proper side of the mask faces outwards, the colored side. Third, after use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes to avoid touching potentially contaminated surfaces of the mask. Fourth, discard the mask in closed bin immediately after use. Perform hand hygiene after touching or discarding the mask. Use alcohol-based hand rub or, if visibly soiled, wash your hands with soap and water.